Have you ever brushed off a little swelling in your feet, blamed feeling tired on getting older, or thought getting up several times a night to use the bathroom was simply part of aging? Many people do, but sometimes these small changes are your body's quiet way of asking for help. Your kidneys can lose a great deal of their function before obvious symptoms appear, which is why recognizing early warning signs becomes even more important after the age of 60. In today's video, we're talking about 7 early signs of kidney trouble that you should never ignore. Some of these signs are surprisingly easy to miss, while others are often mistaken for completely different health problems. And one of the last signs we'll discuss is especially important because many people don't realize it can be connected to the kidneys at all. Your kidneys work around the clock, every single day. They filter waste from your blood, help control blood pressure, balance fluids and minerals, and even play a role in making healthy red blood cells. As we get older, it's natural for kidney function to decline a little. But conditions like high blood pressure, diabetes, heart disease, certain medications, and even dehydration can speed up that decline. The encouraging news is that early kidney problems can often be managed more effectively when they're found sooner rather than later. So let's begin with the first warning sign. The first early sign is changes in urination. Since your kidneys make urine, changes in your bathroom habits are often one of the earliest clues that something may not be quite right. Maybe you're waking up much more often during the night to urinate. Perhaps you're going less often than usual, or you notice your urine looks darker than normal. Some people see foamy or bubbly urine that doesn't disappear quickly. Others notice blood in the urine, although this can also have several other causes. Imagine someone who has always slept through the night, but suddenly starts getting up 3 or 4 times to use the bathroom. It's easy to blame age, drinking too much water before bed, or a restless night's sleep. But if this change continues, it's worth bringing up with your healthcare provider. Foamy urine deserves special attention because it may sometimes suggest that protein is leaking into the urine. Healthy kidneys usually keep important proteins in your bloodstream. When the filters become damaged, some protein can escape into the urine. That doesn't automatically mean serious kidney disease, but it is a reason to get checked. Keeping track of changes can be helpful. If you notice a new pattern lasting more than a few days or recurring frequently, make a note of it so you can describe it clearly during your appointment. And while changes in urination are important, the next sign often appears in a completely different part of the body. The second sign is swelling in the feet, ankles, or around the eyes. Have you ever taken off your socks and noticed deep marks around your ankles? Or perhaps your shoes suddenly feel tighter by the end of the day. When kidneys aren't removing extra salt and water efficiently, fluid can build up in the body's tissues. This often shows up first in the lower legs, feet, and ankles because gravity pulls fluid downward. Some people also wake up with puffiness around their eyes. Of course, swelling has many possible causes. Standing for long periods, heart conditions, liver disease, certain medications, or problems with the veins can all lead to swollen legs. That's why it's important not to jump to conclusions. However, swelling that is new, persistent, or getting worse deserves medical attention, especially if it's combined with other symptoms on today's list. One practical step is to notice when the swelling happens. Is it only after a long walk? Does it improve overnight? Or is it becoming an everyday problem? These details help your healthcare provider understand what's going on. Coming up next is one of the most commonly overlooked signs because nearly everyone experiences it from time to time. But when it becomes persistent, it may be telling a much bigger story. The third sign is ongoing fatigue and low energy. Many older adults assume feeling tired is simply part of getting older. While energy levels can change with age, constant exhaustion isn't something to ignore. Healthy kidneys help produce a hormone that signals your body to make red blood cells. These cells carry oxygen throughout your body. If kidney function declines significantly, your body may produce fewer red blood cells, leading to anemia. Anemia means there aren't enough healthy red blood cells to carry oxygen efficiently. As a result, you may feel unusually tired, weak, short of breath during simple activities, or unable to concentrate. Picture someone who used to enjoy gardening every morning, but now feels exhausted after just a few minutes outside. They may assume they're simply slowing down, when in reality, there could be an underlying medical issue that deserves evaluation. Fatigue has many possible causes, including poor sleep, thyroid problems, vitamin deficiencies, depression, heart disease, infections, and certain medications. That's why persistent fatigue should never be self-diagnosed. If your energy has noticeably declined for several weeks without a clear explanation, it's a good idea to discuss it with your healthcare provider. A simple blood test and urine test can often provide valuable clues. Now, here's something that surprises many people. The next warning sign doesn't involve the bathroom, your legs, or your energy. Instead, it often shows up on your skin. The fourth sign is itchy skin. Dry, itchy skin is common, especially during colder months. But severe or ongoing itching without an obvious cause can sometimes be linked to kidney disease. When the kidneys struggle to remove waste products and keep minerals balanced, changes inside the body may affect the skin. Some people develop persistent itching that moisturizers don't fully relieve. Imagine scratching your arms, back, or legs day after day without seeing much of a rash. You switch soaps, try different lotions, and still the itching continues. Although eczema, allergies, liver disease, medication reactions, and many other conditions can also cause itching, unexplained symptoms that continue should be evaluated. Taking care of your skin by using gentle cleansers, moisturizing regularly, and avoiding very hot showers may help with ordinary dryness. But if itching becomes severe or is accompanied by other symptoms we've discussed, don't simply assume it's dry skin. We're halfway through the list, and the next sign often affects everyday activities, like enjoying a favorite meal. The fifth sign is changes in appetite, or a metallic taste in the mouth. Your kidneys help remove waste products from the bloodstream. When they don't work as well, those waste products can build up over time. Some people notice food suddenly tastes different. Others develop a metallic taste, or find that favorite meals no longer seem appealing. Some lose their appetite altogether, or begin losing weight without trying. For example, someone who has always looked forward to family dinners may suddenly push food around the plate because nothing tastes right anymore. Again, these symptoms are not specific to kidney disease. Dental problems, certain medications, infections, digestive disorders, and many other conditions can also affect taste and appetite. Still, unexplained changes that last for weeks deserve attention, especially if they're paired with weight loss or several of the other warning signs we're discussing today. Good nutrition remains one of the best ways to support overall health. Rather than following restrictive diets without medical advice, talk with your healthcare provider or a registered dietitian if you're experiencing appetite changes, particularly if you already have kidney disease. Now let's move to a symptom that many people mistakenly blame on getting older muscles. The sixth sign is muscle cramps. Occasional muscle cramps happen to almost everyone, but frequent cramps, especially at night, may sometimes signal that your body's balance of minerals like potassium, calcium, or magnesium has changed. Healthy kidneys help regulate these minerals. When that balance is disrupted, muscles may not function normally. Of course, dehydration, certain medications, overuse, nerve conditions, and circulation problems are also common causes of muscle cramps. If you're having repeated cramps along with swelling, changes in urination, fatigue, or other symptoms on this list, it's worth mentioning all of them together rather than discussing each symptom separately. One practical habit that benefits many older adults is staying adequately hydrated unless your healthcare provider has advised you to limit fluids because of heart failure, kidney disease, or another condition. Drinking enough water supports many body functions, although water alone cannot prevent or reverse kidney disease. We're down to the final warning sign, and it's one that many people never associate with the kidneys at all. The seventh sign is high blood pressure that's difficult to control. The relationship between the kidneys and blood pressure works both ways. High blood pressure can damage the kidneys over time. At the same time, damaged kidneys can make blood pressure even harder to control. This creates a cycle where each problem can make the other worse. Imagine taking blood pressure medication faithfully, eating reasonably well, yet your readings continue creeping upward. Your healthcare provider may decide it's time to check kidney function as part of the evaluation. That's one reason routine health checkups become increasingly valuable after age 60. Simple blood tests can estimate how well your kidneys are filtering waste. Urine tests can detect protein, or blood, that may signal early kidney problems long before serious symptoms develop. Even if you feel perfectly fine, regular screening may be recommended if you have diabetes, high blood pressure, a family history of kidney disease, heart disease, or you've taken certain medications for long periods, including frequent use of some pain relievers. Now that we've covered the 7 warning signs, let's talk about what you can do to help protect your kidneys as you age. First, keep chronic conditions under good control. Managing blood pressure and blood sugar is among the most effective ways to protect kidney health. Second, attend regular medical appointments and complete recommended blood and urine tests, especially if you are in a higher risk group. Third, stay hydrated unless you've been instructed otherwise by your healthcare provider. Fourth, be cautious with medications. Some over-the-counter pain relievers, especially when taken frequently or in high doses, can affect kidney function. Always follow dosing instructions and ask your healthcare provider or pharmacist if you're unsure whether a medication is appropriate for you. Fifth, avoid smoking if possible and limit alcohol according to your healthcare provider's advice. These steps support not only your kidneys, but also your heart and blood vessels. Sixth, stay physically active in ways that are safe and enjoyable for you. Regular walking, swimming, gentle strength exercises, or other approved activities can help support healthy blood pressure, blood sugar, and overall circulation. Finally, don't ignore persistent symptoms simply because you're getting older. Aging changes the body, but ongoing or worsening symptoms deserve attention. Remember, having one of these signs does not automatically mean you have kidney disease. Many of these symptoms have other possible explanations. The important message is not to diagnose yourself, but to recognize when it's time to seek medical advice. Early detection often provides more options for treatment and can help slow the progression of kidney disease if it's present. Your kidneys work quietly every day without asking for much in return. Giving them a little attention today may help protect your health for years to come. If you found this video helpful, we'd love to hear from you. Which of these 7 warning signs surprised you the most? Have you ever experienced any of them, or learned something new today? Feel free to share your thoughts in the comments, along with your age and the country you're watching from. Your experiences may encourage someone else to pay closer attention to their own health. And if you enjoy practical, evidence-based tips for healthy aging, be sure to join us for future videos. Until next time, take good care of yourself, Stay curious about your health, and remember that small changes noticed early can sometimes make a very big difference.